All right, let's talk about your healthy living. This is a really interesting topic, guys. While menopause, very natural part of aging for women, perimenopause can begin 8 to 10 years before your cycle actually stops altogether. So according to a new study in Women's Health, over half of females ages 30 to 35 experience moderate to severe perimenopause symptoms. The findings show that the majority of perimenopausal females don't even seek treatment for their symptoms. So to explain why and what we need to know now, we welcome Dr. Reena Mehta. And obviously, we know you from the allergy world, the Uptown Asthma Clinic as well, of course, but you wanted to talk about this because you hear it among your patients that walk into your clinic and say, what is this brain fog? Is it allergies?
Yes, I hear this all the time, and also being a 41-year-old female, you know, there's personal things involved in here too. So, you know, I hear a lot of women complain about very non-specific symptoms like, you know, insomnia, irritability, you know, sometimes there's hot flashes, sometimes there's not, brain fog, things like that. And, you know, this study was interesting, published in Women's Health, which looked at women ages 30 and older, and they found that actually more than 50% of women in their 30s actually had some perimenopausal symptoms, but only 4% sought medical treatment.
There's such a misunderstanding about when you hit that age.
Yes.
Talk about the difference in definition, perimenopause versus the start of actual menopause.
Okay, so we think of the average age of perimenopause being about 45 and menopause hitting in your 50s. So we really think of this as like your, you know, 50-year-old sort of disease process, not disease process, but natural process. But there's a spectrum. With anything, there's a spectrum. And the thought is that these symptoms can start almost 10 years even before it happens. You can gradually start decreasing your estrogen levels over time so that you don't quite realize what's happening. A lot of women don't even know that they're going through perimenopause because they just kind of feel like, well, maybe it's my general life, maybe it's my lifestyle, maybe I'm stressed, maybe I have young kids,
right?
You know, and so they sort of dismiss it. Or if they go to a provider, they may get dismissed there because, you know, someone might say, well, you're too young to have perimenopause. Right. But the truth is that if you're actually having these symptoms, there may be some things that you can do that can make you feel better.
What is the test to ask for that may not be offered to you to really check what your hormones are doing? And then what is the medical intervention if you are just starting perimenopause?
Yeah, so it's not always hormone replacement therapy. You know, there is, you know, that's where I would defer to your gynecologist, your provider who's hopefully skilled in hormone therapy, but certainly checking hormone levels to see where the imbalance is and how to bring that into further equilibrium. Sometimes it is hormone replacement therapy through patches, through pellets, through oral route. And then a lot of things can be helpful in terms of like natural stuff like stress management, you know, trying to get enough sleep at night, trying to do weight-bearing exercises can be something that can really help with some of the joint pain, the insomnia. Yeah. The gut microbiome is a whole topic that we could talk about, you know, at length.
Yes.
Yes, but trying to get into a healthy state where your body is more in equilibrium, and then also dealing with the hormones with the provider who is skilled in talking about this.
That's it. And leave us on that note as we go over to Zach in a second. What is the right way to find the right doctor for this type of stage in your life?
I think starting with your general gynecologist. Most women at this age do have an OB-GYN that they're plugged in with. And then, you know, if that you know, provider isn't skilled in this, they might have an option of who you can go to next.
All right. Everybody's getting smarter on this, and it's great to see it. Thank you.
Thank you for having me.